Welcome back to the Neurology 101 series on the ProPA podcast. I'm Dr. G, and today's episode focuses on the subdural hematoma, a condition you'll see in both trauma patients and the elderly, and one that's often mistaken for a stroke, intoxication, or even dementia. Let's break it down. Did you know that subdural hematomas are particularly common in older adults due to cerebral atrophy, which stretches the bridging veins, making them more prone to rupture, even from minor trauma like a fall from standing? Let's look a little deeper at the kinder patho. What is a subdural hematoma? Well, a subdural hematoma is a collection of venous blood between the dura mater and the arachnoid mater, usually caused by tearing of bridging veins. Because venous pressure is lower than arterial, symptoms tend to have a slower onset compared to an epidural hematoma. Subdural hematomas can be acute, which is less than 72 hours, subacute, which is between 3 and 7 days, and chronic, greater than 7 to 21 days. So, how do these patients typically present? Well, symptoms can vary widely. They can include headache, confusion, somnolence, focal neurologic deficits, personality changes, seizures, vomiting, and in severe cases, coma. In chronic subdural hematoma, patients may mimic dementia or depression in older adults. All right, how do we do the diagnosis here? We want to get a non contrast CT, and this is going to be our first line imaging. We may see a classic finding of a crescent shape or concave hyperdensity, and this hyperdensity may cross suture lines, unlike epidural hematomas. Chronic bleeds appear hypodense or darker due to blood breakdown over time. So, how do we treat these conditions? Well, it really just depends on the severity. If we have mild or chronic subdural bleeds, we can monitor, manage symptoms, and repeat imaging. If we have severe or acute bleeds, we want to get a neurosurgical evacuation. They can do a burr hole or a craniotomy. ICP management is needed with head elevation, hypertonic saline or mannitol, and seizure prophylaxis if indicated. Let's look at the book med versus the street med. So book med, we're going to have an elderly patient who presents after a fall. CT is going to show that crescent-shaped subdural hematoma, and we're going to monitor them closely with neurosurgery on board. Street med, we might have an 82-year-old patient brought in by family for simply acting weird after a fall 2 weeks ago. CT is going to show that chronic subdural hematoma. Surprise! All right, some quick clinical pearls. Bridging veins equals subdural, middle meningeal artery equals epidural. Slower onset and wider spectrum of symptoms than an epidural bleed. Think subdural in patients with head trauma plus confusion. Alcoholics and elderly are at higher risk, and we want to look for a midline shift in severe cases. Now let's test our knowledge. An elderly patient presents with new onset confusion and gait instability. CT shows a crescent-shaped hypodense lesion. What's the most likely diagnosis? Is it A, chronic subdural hematoma, B, epidural hematoma, C, subarachnoid hemorrhage, or D, brain abscess? I'll give you a few seconds. If you said A, chronic subdural hematoma, you are correct. The crescent shape and gradual onset suggest a chronic subdural hematoma. Question 2. Which of the following risk factors is most associated with chronic subdural hematoma? Is it A, hypertension, B, diabetes, C, aneurysm, or D, cerebral atrophy? If you said D, cerebral atrophy, you are correct. Remember, atrophy stretches bridging veins, predisposing older adults to subdural bleeds even with minimal trauma. Okay, so some final thoughts. Subdural hematomas can be subtle but dangerous. Stay vigilant, especially in trauma cases involving the elderly, an alcoholic, or anticoagulated patients. In our next episode, we'll review other causes of encephalopathy, from Wernicke's to hepatic to toxic. If these episodes are helping you visualize CT findings or approach head trauma with more confidence, send the podcast to your study group. And remember, this is the ProPA podcast. where future pros in medicine are made. Catch you later.